I'd like to introduce you to the topic of regenerative orthopedics, which is something that has been going on for some time, but which has only relatively recently collected this title, and people are becoming more aware of the whole field around which it is wrapped. Basically, it involves using the body's normal healing processes, but augmenting them in some way. I'm not talking about medications, I'm talking about physical processes, augmenting normal healing with a physical intervention. So that's what's known as regenerative orthopedics. There are two separate clinical fields that are encompassed by regenerative orthopedics. The one is the field of orthopedic regenerative medicine. That is, non-surgical augmentation via injection, which can include stimulating the local tissues via a form of irritation to heal themselves, adding repair substances that again help to trigger the whole process of repair, and adding the actual repair cells themselves into the damaged area. The other component of regenerative orthopedics is orthopedic regenerative surgery, which means that the doctor has entered the area with a scalpel and unloaded tissues that are stressed, or surgically repaired or improved damaged tissues structurally using biological materials, possibly in association with unloading them from stress, and also augmenting surgical repair using organic materials engineered in a laboratory. So together, regenerative medicine and regenerative surgery in orthopedics can be thought of as regenerative orthopedics. Of course, the surgeon is licensed to offer the medical interventions, but not the other way around. A doctor who's not qualified in surgery will not be allowed to do the surgical part of it. That is fairly relevant, as a patient may be uncertain as to whether the doctor who is managing them is a surgeon or a physician, or the patient may not be aware of this very important distinction. Now we will go through each of these possible interventions one at a time. Orthopedic regenerative medicine. Increasing local tissue irritation. It seems odd to think of healing or regenerating a body part by making it more irritated, but in fact there's a whole area of clinical practice here that does show that in many cases this works. The science is called prolotherapy, and it relies on injecting irritant substances like dextrose into the tissues over a period of time, thus triggering and speeding up a chemical and cellular healing cascade, which was clearly not progressing at an optimum speed. It is particularly relevant to the management of ligament, tendon, and meniscus problems. The procedure apparently carries little risk, other than those such as infection that may be associated with any injection through the skin. Of course, the prolotherapist needs to be experienced in assessing the soft tissue problem and skilled at the actual injections themselves. Adding repair chemicals. The next section I'm going to look at in orthopedic regenerative medicine is the technique of injecting platelet-rich plasma. When we talk of adding repair chemicals, what I'm talking about with respect to regenerative medicine is repair chemicals that are actually extracted from the patient's own body. So they are natural repair chemicals, and the most important of these is platelet-rich plasma. This is also called PRP. To obtain PRP, a sample of the patient's blood is taken and it is spun in a centrifuge, and the platelets are separated out into a thin whitish layer from the red blood cells. That platelet-rich layer is drawn up in a syringe and used for this procedure. Platelets exist in the bloodstream together with red blood cells, white blood cells, and other components. They are rather an incomplete cell inasmuch as they don't have a nucleus, and they are about a fifth of the size of a red blood cell. But they exist primarily, it appears, to stop bleeding and facilitate coagulation. In terms of what we're talking about here, that is, repair, they contain important chemicals, in particular growth factors such as cytokines, which are extremely important in the repair and healing process. So by separating out the platelets, concentrating them and injecting them back into the damaged area, the tissues there are given a kickstart to healing. Adding repair cells. Although platelets are to some extent cells, they are not cells that reproduce themselves, but an important part of orthopedic regenerative medicine is the injection into the damaged area of cells that can readily reproduce themselves. In fact, to such an extent that they are known as stem cells. Now, the whole field of stem cell injection is at the moment a hot topic. The issue is that adult mature cells that you find normally in tissues can only reproduce into similar differentiated cells. In other words, they're cartilage cells or muscle cells, and they can't readily turn into other types of cells. Some years ago, the field of stem cell research started with the use of cells extracted from embryos, because embryonic or fetal cells were found to have this capacity to not only reproduce readily, but to be able to differentiate into different types of tissue. However, it opened a huge can of worms because of opposition from pro-life activist groups. Cells from the umbilical cord, which of course were being thrown away, were accepted more readily, but the opposition to stem cell research at that time led to the Bush administration in the United States restricting government funding for this work. A lot of stem cell research thus happened in countries outside of the USA, and that is where many of the very established clinics currently are. The USA is playing catch-up now, since the current USA administration has resumed funding for research. The consequence of all this is that treatment is generally expensive from the point of view of the patient, and there hasn't been a significant period of American experience in terms of the publication of long-term outcomes. So patients are committing themselves to expensive procedures without having absolute confidence in the outcome, and in many cases they are traveling to remote clinics for their treatments. Orthopedic regenerative surgery. Now we get on to the next main section of regenerative orthopedics, which is the whole business of surgery. Clearly, the surgery will be undertaken by an orthopedic surgeon, generally with a special interest in using biological regenerative techniques rather than replacing tissues with metal and plastic or other artificial materials. Unloading stressed tissues. So the first one we're going to look at is the business of unloading stressed tissues. There are several circumstances where abnormal stresses on an area lead to further breakdown of tissues. The most common one that I can think of is after removal of a meniscus, where the lack of this shock absorber stresses the joint cartilage and may alter the alignment of the limb. Another is where a ligament reconstruction procedure requires correction of the limb alignment to minimize strain on the reconstruction. A third is to protect areas of joint cartilage repair, where the forces through the cartilage need to be reduced to allow healing. The stresses on these areas may be reduced by cutting and realigning the bones of the leg, a procedure which is called osteotomy. The decision of which procedure to undertake and the degree of correction necessary is made after doing long leg standing x-rays and using computer programs to calculate the optimal degree of alignment correction. Biological repair or reconstruction. Most people nowadays, thanks to the media surrounding the injuries of sportsmen and women, are familiar with reconstructive surgical procedures for knee ligaments and menisci, including transplants. These procedures may also be augmented by PRP and stem cell interventions. Articular or joint cartilage procedures, too, include both autotransplants and also several different kinds of surgical procedure to bring stem cells into the damaged areas. This includes microfracture, puncturing the underlying bone to allow marrow stem cells into the region, and several techniques of multiplying cartilage cells in a laboratory and returning them into the region constrained behind a membrane. Engineering tissues in the laboratory. This concept leads on quite easily from the procedures we've just discussed. I talked about multiplying cartilage cells in the laboratory, but techniques have gone well beyond the relatively straightforward multiplication of mature cells for repair of damaged tissues. We discussed also the concentration of platelets from the blood. Well, now it's possible to concentrate blood stem cells and stem cells from the bone marrow and put these into damaged areas. But laboratory techniques have gone even beyond that, and scientists are able to take mature tissue like fat and encourage these mature cells to de-differentiate so that they become like stem cells and can be encouraged to grow into completely different tissues. In terms of engineering, another important engineering concept is that of scaffolds. A scaffold is an engineering construct made from substances such as collagen, which can replace damaged areas. A scaffold can be seeded with cells, and eventually the scaffold itself is absorbed, and the cells that seeded it will remain as a new tissue. It may be inferior, but nonetheless it's very similar. I trust this overview has put this very big topic into some perspective for you, and allow you to continue your researches with greater understanding. Thank you, and please remember to subscribe to our YouTube channel.
Don't forget to like this video and subscribe to our channel. Learn more about your knees at KNEEguru.co.uk.